I'm Dr. Anurag Gupta, Senior Neurosurgeon at Narayana Hospital, Gurgaon. Today we'll be talking about cervical laminectomy and cervical laminoplasty. So first, what is a lamina? Now, this is the model of the cervical spine, and the back part of the cervical spine, if you look at here, this is called the lamina of the spine. So any surgery where we remove this bone is called a laminectomy, or in a surgery where we keep this bone and we sort of open it up is called a laminoplasty. Now, this surgery is required when a patient may have disease affecting multiple levels of the spine. Suppose they have a disc disease, or they have a narrowing of the spine at multiple levels, generally more than 3, or if there's a tumor inside the spinal canal which requires access to get up to the tumor, these bones may be removed. Now, traditionally, the laminectomy was a traditional surgery where the surgeon used to remove the bones from behind at maybe multiple levels. But it was found that if once we do that, these people tend to develop what's called a swan neck deformity over time, because the muscles and the bone here keep the spine in position. And when this support is removed, the spine can tend to go forward and can form a deformity. So when we do a wide laminectomy, when we do a multi-level laminectomy, it is now customary to perform a fusion along with it, where multiple screws are placed at 4 to 5 levels, and they're fixed with a rod as to prevent a deformity over time. Now, an alternative to this surgery, especially when there is a lot of narrowing at multiple levels, is called a laminoplasty. Now, the laminoplasty is basically where the bone is not removed completely, but an attempt is made to widen the spinal canal as to give more space for the spinal cord. Now, there can be multiple types of laminoplasty. The most commonly one performed is called an open door laminoplasty. In this laminoplasty, the bone is cut at this, their cuts are made at this multiple levels, and the whole spinal cut process is sort of, opened up like a door, like an open door. So the whole body, the spine moves backwards like this, and thus gives more space for the dura, for the spinal cord to expand outside, thus relieving it of pressure. And in this surgery, there is no need to put multiple screws at different levels, so the complexity of the surgery comes down. Once we put screws on multiple levels, what happens is the spine movement, you cannot move your spine because it is fixed by rods. This is in laminoplasty, this is avoided. And because implants are obviously expensive and they're leaving a foreign body inside your body, that thing is avoided by laminoplasty.